So Andy is Chief Commercial Officer for Premier. He oversees the member-embedded field force and supply chain services growth teams. Andy is focused on helping Premier members achieve both quality and cost imperatives through the integration of Premier's end-to-end supply chain, quality, safety, and operational solutions. Throughout his tenure, he has successfully partnered with members, suppliers, and staff to develop and design customized and scalable solutions to quickly meet evolving needs in a dynamic healthcare industry. Please join me in welcoming Andy.
So Amy told me she was going to do that and say that she's going to get everybody ready for the next part of the evening. So the cliche line that I'm going to say is, I'm between what's you and the cocktail hour, right? That's what everybody says at this time. But in all candor, thank you, Amy, and thank you, Larry, and thank you, the whole Yankee team. It is really an honor, and it's humbling to be here. When the kickoff started this morning, and it was said that it was 37 years that this organization has met like this, it's really just amazing to think about the unbelievable work that's been done over the history of this partnership. And I personally have been involved with Yankee for about 2.5 decades, so for me, it's just really exciting to see all this camaraderie and the sharing of knowledge that you guys have. I want to hit on a couple of things, but first, I want to talk about the partnership with Yankee. And it's something that's incredibly intentional, I think, on both parts. And, the theme of the conference being partnership, we're just humbled by the partnership we've had with Yankee. To the point earlier, it's been over 2.5 decades that we've had the pleasure of working with Yankee. Back when we went public in 2013, we started really keeping track of, well, what was that new economic value, one dimension of value that's there. And when you look at the slide, it's over $340 million worth of value that we've collectively developed together. And that's through participation in the GPO portfolio, it's through the equity, it's through the dividends, and it's really through the relationship which forged many years ago. Collectively, the purchasing power of Yankee Alliance and all of you in the room is at $1.3 billion. That's a phenomenal amount, and it's a number that's grown year over year on the average of about 3 to 5%, obviously down a little bit during the pandemic, but again, speaks volume. And why is that an important indicator for us? Well, it means you're using the portfolio, and the portfolio is driving value. And increasingly, some of that value comes from some of our committed programs, which I will talk a little bit about today. Now, when I talk about the committed programs, one of the things I do want to hit on is you guys actually have, and I have to look and make sure I get it right, it's an 88% compliance in the Ascend Drive program across the Yankee portfolio. That is huge. And we do passionately believe, that as we look to the future of healthcare supply chain, high commitment is what's going to differentiate the purchasing power. I also want to recognize Capital Regional Healthcare, who's the newest member of Ascend Drive and ramping up. So thank you for participating in the program. I'm going to hit a couple of things this afternoon. I want to talk a little bit about what's happening. Shomi, everybody in here for Shomi's presentation this morning? Yeah, she's wonderful, isn't she? Great job. So she did a great job of talking through, I'll call it HR1. I cannot bring myself candidly, and this is not a political statement, I can't bring myself to calling it one big beautiful bill, because I'm still trying to find something beautiful in that bill for the folks in this room. So I will always call it HR1. But when we think about what's happening with HR1, it sets the foundation for the heavy lifting we've all got in front of us. So I'm going to talk about HR1. I'm then going to hit on how that's influencing Premier's strategy. And then we'll do a deep dive into what we think the supply chain of the future needs to look like. We'll also do a deeper dive into the GPO. And then I'll end with an update on Premier's recent announcement about getting acquired by Patient Square Capital. And then I will open it up for questions. So if there's something that comes up, please jot it down. I'll be happy to address it at the end. So, one big beautiful bill. I think the number that stands out at me, and Shomi says this a couple of times, is the $1 trillion impact it's going to have on healthcare through a number of different facets. Now, I am going to do a terrible job trying to recreate Shomi's presentation, so I won't attempt to do it. I'll let you read the slide up there, but it sets the foundation of the challenges that we are all facing. When I think about the challenges we are all facing, one thing also jumps out. We're no strangers to what's happening from the policy perspective. We've had impacts of healthcare reform in the past. What's different this time is there is no facet of healthcare that's not getting touched by this. So in the past, we would say, well, not-for-profit healthcare, they're going to have something happen to them. Or maybe I was a for-profit public entity, healthcare provider, so I could have some different levers that I could take advantage of. Or I was rural healthcare. Or I'm an academic healthcare, so I can lean on my research. All of that is out the window right now. Every facet of healthcare is getting impacted by H.R. 1. So we recently did a webinar where we shared some of the strategies that our members were recommending do to prepare for what's coming down the line. Another stat I have highlighted here, which is one that jumps out at me. So 1 trillion is what I've always think about in my head, but the other is the impact in net patient revenue. It's highlighted here. So on the average, somewhere in the 3 to 8% net patient revenue impact. Think about that. 3 to 8% of your net patient revenue could go away as a result of this. And it's a lot of different levers. It's 340B, it's site neutral payments, it's Medicare. All of these things impacted will change the dynamics of how healthcare functions today. I forget who it was that asked the question this morning, but it was about rural healthcare. Me personally, that scares the heck out of me. I grew up in a small town in New Jersey. We were equidistant from Philadelphia and New York, which meant we were nowhere near, at that time, great healthcare access. I've used this, I'm sure many of you have had this experience as well. You know, when you're having a cocktail or when you're at a party and your friends ask you what you do or your acquaintances ask you what you do, invariably they always ask about, well, what's happening with healthcare and H.R. 1? And the thing I always equate it to is if you've ever been to, like, you know, Mexico or to the islands, you know, it's kind of like I worry about what I fear healthcare could be in this country. And what I mean by that is you land in the airport when you go to, like, Pickett, go to Aruba. You land in the airport. Looks like every airport you've ever been at here. You go to the hotel. That hotel looks like every hotel you've ever stayed at here. But in that cab ride from the airport to the hotel, it feels like you're seeing huge variability in living conditions, in access, just in the people that live there. That's what I worry about healthcare is going to be like. If we're not careful, if you're not near an urban population, or if you're not near an academic institution, your healthcare access will be challenged. We all have accountability to address that. So how do we make sure that we're providing for robust healthcare going forward? There's a couple of things that we hit on here. One of them is, and hopefully, and it was great to hear Steve's presentation this morning because it's going to sound like we stole his hit list, but I promise you we did not. But it's great to see these things coming to fruition. So renegotiating your payer contracts, right? Sometimes easier said than done in the market and where you're at. But making sure as a provider, you're getting the best rates you can get. It's taking a look at, you know, revenue cycle. Steve mentioned working with Ensemble and how critical they were during the cyber strike. It's also about, apropos to this conversation, leaning into the partnerships. Your partnership with Yankee, your partnership with Premier, new partnerships that you're forging out there, including some of the partnerships that Amy talked about this morning, some of the newer ones you guys are forging with groups like Capstone. How do you spread the risk over time? And this is going to be, I think, really important for rural healthcare because the investments that are going to have to get made going forward are going to be investments that in many cases are bigger than any individual institution. Now, if you are the Mayo Clinic, if you are the Cleveland Clinic, you're going to have access to capital. You're going to be able to do some things that are unique to you. But that's in those markets. How do we make sure that in our markets, where we're trying to serve our patients, that we can do so both from a quality standpoint, from a financial viability standpoint, and from making sure that we have access to the best caregivers and staff? It's got to be leaning in to some of these partnerships. So what does that look like from a Premier standpoint? Well, we're focusing on developing our strategy. And when I say focusing on developing, you guys all know this. Strategy is not something you design in a room and then you go back to that document and that is the source of truth for the next 5 to 7 years. Strategy is something you should be evaluating almost every quarter or at least every year. And you're going to pivot and you're going to evolve that strategy. Make no mistake about it, the foundation of everything Premier does is the supply chain. And I'm not going to spend a ton of time on this slide talking about it, because I will do a deeper dive. But almost 100% of our membership that we've worked with comes to us as a start with the supply chain. And by doing a good job in the supply chain, that's how we've earned the right to get into some of these areas. So what are some other areas I want to talk about? So quality. Quality is a critical differentiation when you're competing for that patient population. Now, when I'm talking about quality, I'm not trying to convince you that U.S. News and Health Reports is better than Leapfrog or better than 5-Star or better than our own program that we bought, which is the 100 Top. All of those serve a purpose, and if you triangulate all of that data, you'll see that there are similarities with it. Our program, the 100 Top, is about the only program that is also 100% based on actual data. So when we look at our 100 Top, if you are a 100 Top or a 50 Top hospital, it's a pretty good chance you're doing well in all of those other measures as well, the 5-Star, the Leapfrog, et cetera. There is a direct correlation of that. Workforce optimization. We know we are competing for labor like we've never had to before, whether that's from our clinical staff, from our diagnostics, from the cafeteria to the warehouse workers, to the janitorial staff. We are competing for labor against multiple industries. We have to be smarter about our workforce. What does workforce mean when we're talking about being smart? It means embracing technology in many ways. It means embracing AI. I heard this at a Yankee meeting last year, and I've shamelessly stolen it every time. When I think about AI, I don't like to call it artificial intelligence. I like to call it automated intelligence, and I stole that directly from one of the folks in this room. And the reason I say automated intelligence is because there is a fear of jobs changing. There is a fear of losing jobs. The reality is this: AI is moving faster than any of us can imagine. AI will never be as slow as it is right here, right now on this stage, and we're seeing how quickly it's evolving. Think about the things you can do if you're on the Microsoft platform with Copilot today that you couldn't do 2 months ago. It is moving at scary light speed. And it's moving in some cases in nefarious ways. I read this article yesterday. So how many of you are on Facebook? I won't friend you, I promise, but who's on Facebook? Okay. I noticed this thing a couple of months ago, and I knew nothing about it. And there was like this burning anger about Cracker Barrel changing their logo. Like literally, it was driving people nuts. People posting memes, people on there. Well, it turned out, did you see the article in the Wall Street Journal this week? 30 to 35% of that was artificially generated by bots and by algorithms that was feeding in to the anger people were having. So when we think about AI, yes, there's some scary parts of that. When I talk about AI, I'm talking about how it can help us be better and smarter and faster with the labor that we've got. So we've got to think about using our labor and that premium workforce that we've got. Physician enterprise optimization. That's another key strategy for us. Over the last several years, we know so many of our hospital systems have gone out and acquired physician practice groups, acquired staff that are working for them, acquired those physicians. I was meeting with the CEO about 2 months ago, and he said, yeah, I've got this physician practice group. It's 3 docs. They've got an office on a 2nd floor in a downtown about 45 minutes from here. I don't know if they're being optimized. We have tools to help you make sure that you're optimizing those critical physician relationships. And then strategy and growth. This is an area where I do believe we're going to see more mergers and acquisitions over the next 5 to 7 years. So we have built out our advisory practice to help you think about who are the right partners, or is partnership even right? Last 2 pieces, revenue management. We are not trying to be an Ensemble or an R1 or any of those companies that are out there. What we're talking about for revenue management is keepage and leakage. So we've actually partnered with a company. It's really fascinating. So when you talk about big data that's out there. So a couple of years ago, it was a big thing for providers where they're screen scraping Google to say, well, here's a market where somebody's researching a hip replacement, or here's a market where somebody's researching a knee replacement. That's great data. Keep doing that. We're partnering with a company that can not only geofence in a zip code, but it will also tell you, well, are the people searching for that using detokenized data, will they have insurance? What type of insurance do they have? If you think about the outcome side of it, this is the scary data part, it can also tell you, well, where does this population shop? What kind of groceries do they buy? So you can start thinking about how much risk are we going to take on? Should I stand up a freestanding ED? Should we put an ambulatory surgery center there? It's this type of intelligence to help you focus on smart revenue growth. And last and certainly not least, the pace of change for drugs, pharmaceuticals, biosimilars is moving at an accelerated pace, just like the rest of technology. So we've got an applied sciences division that can help focus on bringing patient trials to you, post-FDA trials, real-world evidence trials, where in many cases these drug companies are willing to pay for those research. So these are the key things that we're going to focus on. This is the big chunks of our strategy at Premier going forward. But I talked about kind of where does it come together. This is also an investment we're making. I think most folks in this room are supply chain. If you've ever worked with a consultant or worked with a partner, a lot of times what you'll see is what I call these spreadsheet exercises. It's an analysis that says, if you could just do X, Y, and Z, here's all the savings you could have. Now, the folks in the room that will know what I'm saying, they'll laugh at this. If you could go from 50 spine manufacturers down to one, look at the savings you could have. How many times can you go down to one spine manufacturer? It's an impossibility. I'm looking over at Anne-Marie because I really enjoyed her presentation earlier. So all of this data, how do you sort through this? Well, an investment we're making is putting resources combined with the data. So whether that's our dedicated support team that are experts in figuring out how to project manage and move things through the life cycle of supply chain, or some of our clinical subject matter experts, or increasingly our resources in supply chain extenders. And I'm going to talk about a success story in just a minute where that team's worked together. But it really is all about not just partnering with companies, partnering with people you can trust that you know are sharing your goals, that they're in the trenches with you to help you improve your quality, improve your outcomes, reduce your cost, and they're doing it because they're a partner to the organization, not because they're trying to sell you something else, and that's an important distinction. When we think about technology-enabled transformation, three big buckets, and supply chain margin improvement. So that is supply chain analytics, right? Do we have the right data at the right time to tell the right story to help you make a smart decision on your product and purchasing? Service line analytics. This was something, if you were in Anne-Marie's presentation, she talked about utilization. And Bluepoint is an awesome resource to help doing that. We also look at utilization from a different angle. At the Premier tool, which is supplemental to the tools that Yankees developed, it's looking at your quality outcomes and being able to look at resource utilization going down to the physician level. So if you're looking at drug utilization, you can look at it and say, I've got one outlier that continues to buy a very expensive branded drug. Everybody else is using a generic. There are no differentiated outcomes. Let's take a look and let's surface that individual physician and have a conversation about it. We can also do that on supplies. Procure to pay, I'm going to talk about that in a little bit, but that's basically the womb to tomb life cycle of products and drugs. Care transformation, I talked about quality, clinical surveillance, looking to make sure that there's harm avoidance, and then taking a look at clinical decision support. Clinical decision support, we think, is the next frontier to empower our supply chain professionals. And when we think about pharmaceutical stewardship, when we think about just that scenario I just said, so when I think about service line analytics, that's a retrospective look to figure out what formulary is that physician ordering on behalf of their patient. Clinical decision support is real-time support, where they are putting in that order, there's an alert that comes through the workflow, be that Epic or some other EHR, that says, did you really mean to order this drug? The latest clinical evidence says this. You can still order it and put it through, but at least we've surfaced that. Our clinical decision support intelligence, by implementing that technology, can help improve your patient discharge by $100 per discharge on the average. This is moving the needle in outcomes, and we're working on advancing that so that the same thing happens on medical devices. Where it surfaces up, you may have a lower contracted item with better outcomes. Do you still want to purchase this product? This is the future state of what it looks like from care transformation. And then finally, we look at workforce management. I think I hit on that a little bit. Now, on the workforce management side of it, I'm going to give a little bit of sneak preview. We started working with one of the world's largest AI companies, and we started feeding that our labor and productivity data. And now, my nephew's a gamer, so I'm sure some of you have gamers in your family. When I was a kid, a gamer was pumping greasy quarters into the Pac-Man at the pizza place. My nephew's the gamer, which means he'll stay up all night drinking Mountain Dew and have like orange powder from the cheese puffs in his hair. These engineers that do the AI are a lot like that. You give them a scenario, give them a 6-pack of Cherry Mountain Dew, and they've got it built the next morning. So we fed them tokenized data on the labor. They came back with a scenario in which if you're looking to staff overtime nurses, it will recommend which nursing staff you go to because they haven't hit their overtime yet or that they've got domain expertise. This is the power of AI that can help us proactively control our costs. Now, let's start honing it down a little bit more in the supply chain. Great talk earlier today about value analysis. We believe value analysis is the foundation for the clinical work that we do. In fact, Premier's value analysis guide that we update about every 18 months is the most downloaded value analysis guide in the country. So if you are in value analysis and you haven't seen that, you can go to the website. It's a free document to download. Value analysis, critical, sourcing, contracting, requisitioning, but this is the other piece of supply chain. And it goes back to the labor part of this. We all know sometimes it's hard to get people with domain expertise to come into your organization. And sometimes that domain expertise might only be needed for a specific contract category. Like we're working on our telephony contracts right now. Do I really need somebody who has telephony expertise to take him or her on for the payroll for a long period of time? No. We can bring fungible assets, resources that have that expertise to help you go through specific contract categories. So when we think about focusing on financial improvement, it's about having the right resources. When we think about operational improvement, it's about making sure that you've got inventory and resources and clinical support to go along with that process. And then finally, the last two big pieces of this, clinical integration. Too often quality sits under the chief quality officer, but in supply chain, quality is a critical piece of that. So are we infusing these big data lakes to tell the right use cases? And then last and certainly not least, where do you need interim support? Now, I'm going to share with you an example where this all came together, and that's Kaleida Health. Kaleida Health's foundation was their value analysis. One of the staff there always says this, and I'm going to get the quote a little bit wrong, but she said, you know, for us, value analysis is not a project, because by definition, a project has a beginning and an end. For us, value analysis is a process, and it's a process that everybody in their organization, from their chief medical officer to the supply chain folks, to the nurses helping in the ED and the ER, all of these folks understand the value analysis process. They work hand in glove with an extension of our team, so we do have some co-management resources in there. And I think it was the CEO that said, the reason it works so well is because they are not outsiders to our organization. They are viewed by our team as embedded staff members. They have badges, they share the same goals, as I said earlier, that Kaleida Health has, and that kind of partnership has driven over $100 million of financial improvement in the last several years, starting with that value analysis. And when I say over $100 million worth of financial value, this is not that spreadsheet exercise. This is not, if you could do X, here's the opportunity. This is realized savings. And for us supply chain professionals, one of the toughest questions for the CFOs when they ask you is, well, here's the big identified number. What did it really translate to from the balance sheet? That's the realized savings. And you're going to hear us talking more and more about the importance of identified, implemented, and realized savings. Now, what's different in the GPO? I worked for Premier. I hate to say it out loud now. It'll be like 25 years in February. Supply chain is always a foundation of what we do. But the GPO is not the be-all, end-all of supply chain. Most organizations your GPO participation ranges from about 35 to 55%. And the folks that work in supply chain and lead supply chain know that to be true. So there is a whole large chunk of spend that the traditional GPO does not touch. And that's where you need to look at partners. And Amy mentioned one this morning in MEGA with your capital purchasing. Find the partners that can help you get at 100% of the spend. We, Premier, have invested in focusing on, outside the GPO, additional tools, resources, and expertise to help you get at the non-generic pharmacy. So that includes your specialty pharmacy, your oncology, typically doesn't sit on a national GPO. On your supplies, those supplies that sit outside your national GPO or even your regional GPO. And then finally, your purchase services. We are trying to focus with our members and are focusing on 100% of the purchasing spend. We believe that is a critical differentiator, especially in this time where data is an asset, speed is your lever, and savings is your value. Now, I talked about pharmacy. Our national pharmacy program continues to deliver about 3 to 6% of realized savings when we convert somebody new to Premier. So that means if you're with Premier, you're typically seeing about 3 to 6% of realized pharmacy value on an annual basis through our portfolio. Now, again, if we think about that tail spend, generics makes up a small portion of that. So we have to focus on more than just generics. Intersecta is our specialty and oncology portfolio. That delivers about roughly a little bit less than 11% of savings for those drugs. Now, it doesn't have every oncology drug. It doesn't have every specialty drug on there. That's something we're continuing to build out with the input of our National Pharmacy Committee. We've got our generics program. That's about 20% savings generated for 2025. I won't hit on all this. The key is this. Our pharmacy program, the collaboration that we deliver to our members, drives value year in and year out. Now, I talked about one big beautiful bill. Excuse me. What does that mean for the traditional supply chain and for our GPO portfolio? It means we need to think differently. During the pandemic, we all saw this pivot where it went from, I may have had 5 suppliers, where now I've got to have 15 suppliers. And from a national contracting strategy, our national portfolio was about more suppliers, more categories, more tiers. When we think about the world we live in now, we need to simplify things. We need to get speed to value and reduce the decision-making process. So one big beautiful bill, how we're interpreting that for the supply chain, is we are focusing on more committed programs. We're focused on making sure that we are using our committees and our data to make sure that we've got ample supply chain, meaning that our suppliers have backstop and inventory for us, clinically efficacious products, and that we've got the right representation to help you implement those new categories. So it is about a national portfolio fine-tuned for the circumstances in the world we're living in now. How does that manifest itself? Well, Larry talked about this morning, Ascend Drive. That is one of our committed programs. Yankee has been an incredible supporter of that. I mentioned that collectively the Yankee membership have an 88% compliance. You guys are leading the program. So I'd love it if you wouldn't mind, those that are in it, give yourselves a round of applause. So thank you. To our supplier partners in the room that are part of Ascend Drive, we thank you. And those of you that are in Surpass. Surpass is a higher committed program, less choice, more savings, but you have to drive higher levels of commitment. And it's something that we don't shy away from talking about, so that as you are advancing through Ascend Drive, at some point, maybe Surpass might be a great fit for you. And that's where our team of folks working hand in glove with our Yankee colleagues will be there to have that conversation with you. We will use your data to show you where you can get higher savings. And in some cases, when we look at market baskets, our members are surprised by it. Like 90% might feel like a high level of commitment, but if you're above the average in Yankee, which is 88%, you may already be hitting the commitment levels for Surpass. You might have to do a couple of conversions. You might have to standardize a couple of categories, but in large part, there's some savings that you're just on the precipice of achieving. So Ascend, Drive, and Surpass will be important programs you're going to continue to hear us building out. Now, in that build out, I won't focus on the past. I'll focus on the present and the future. Who was that? Matt that was using that this morning that was talking about the Christmas analogy, or was that Dwayne? I can't remember which one it was. But ghost of Christmas, present, and future. So in the present, what's happening right now? We're starting to focus in and bring in some purchase services categories. We still believe purchase services is best done regionally, and you guys have a great partnership for your purchase services within Yankee. There are some categories, though, that through mergers and acquisitions, some of these companies are getting bigger, so it's a great opportunity to do those purchase services categories on the GPO. What we're also going to be rolling out in the next few weeks within Surpass is a physician preference product category. And that's going to be rolling out, again, less than an all play and big savings to be achieved if you can drive and narrow down your choice. The future state for us is really about broadening those portfolios with our membership. So we've seen both Ascend, Drive, and Surpass grow over the last several years. We want to continue to see those accelerate because we know, and we hear it from our suppliers, the more we can standardize appropriately, the more we can reduce variability from a quality perspective, the better our costs and our outcomes are going to be. So there is a value to standardizing from a clinical standpoint, not just from a cost standpoint. And as anybody in this room will tell you, it's the quality conversation we have to have, not the cost conversation we have to have when we're working with our clinicians. So in our committed programs, we have adjunct staff that live in that quality space that can help you achieve those savings. All right, supply chain analytics. Data is critical. I heard that mentioned a couple of times today. Data is king. We are expanding the types of data that we are infusing into our database. So we've always had PO data, we've always had the quality data, we've always had the feeds coming from our EHR. Increasingly, what you see us wanting to collect is the invoicing data. Because with that invoicing data, we can do some incredibly powerful things. We get together with our supplier partners. We've got a group of a supplier executive panel. It's called our SEAC committee. They meet sometimes with our strategic advisory committee, which Amy is a part of. One of the things the suppliers are increasingly saying is, I now, the supplier, have had to ramp up my back office staff to manage price activations, to manage the data piece of this for our members, to do the cross-reference. I never thought I'd live to see this day where the suppliers are saying, I need to take that burden off us and shift that to our GPO and to our GPO partners. With that invoice data, we can, with great precision, be able to tell you what tiers should you be on. We can also, at the same time, as opposed to waiting for our suppliers to tell us what are the admin fees you've earned, we could invoice our suppliers exactly what your administrative fee share should be. So there are a lot of use cases that are coming down the line with this invoice data. You're going to hear us talk more about that as we go forward. We also need to look at price optimization. So with that invoice data, we are already starting to centralize the mechanisms by which we can turn out, when a new contract rolls out, we can do customized analytics for each of your facilities in just a couple of hours to show you exactly what your options should be. Should you standardize? What if you shifted your volume a little bit? What if you went from 5 suppliers to 3? What would that look like from a pricing perspective? This is the power of the data. Now, when I talk about going from reactive to proactive, and it was talked about earlier, supply chain shortages. We are using our data to be able to predict where supply chain shortages could be. Think about it like a Doppler radar, right? I'm thinking about it right now because we're all watching, unfortunately, what's happening with the hurricane in Jamaica. You can see the storm coming. It could make a right turn, it can make a left turn, it might miss you. But we have to be prepared for the storm coming in. That's the way we think about supply chain disruptions. Our tools, on the average, can spot the signs of that storm brewing several weeks in advance. And it's a tool that our members can use to take a look at that. It's a tool that we use to predict where there might be disruptions. Now, I'm going to talk about it just briefly because those 2 scenarios are really important. We all know, those of you that work through a distributor and through a wholesaler, there's only so much you could purchase before it trips an alarm and they say you're ordering over your allocation. But knowing that a shortage is coming, you can start pushing it up to that edge. You can start thinking about who are the other suppliers I need to talk to. On the Premier side of it, in many cases, we can spot the shortage before the manufacturer who's going to announce that shortage even knows about it. We can also start picking up the phone and calling their peers and saying, I know you're just in time, but you might want to start ramping up production. So we're using that supply chain disruption data to help us make better, faster, smarter decisions. And we're doing that in pharmacy as well through one of our pharmacy tools, Cognitive RX, which can identify where the drug shortages are going to be. Now, the last piece of it is the word that Shomi said in the t-shirt she showed this morning, which is tariffs. We've got a real-time interactive tool where you can go into the platform. It's basically the map of the world. You can click on geographic regions, and we're using country of origin data to predict and show what the tariff increase might be. Now, let me be really, really clear. Shomi said it earlier this morning. Our members, we are glad to say, and we believe this to be true because the data shows it, those that are using a Premier contract have not taken any tariff increases. Our committees, many of you sit on those, have one answer when a supplier comes to us and says, I'd like to impose a tariff increase. You want to guess what that answer is? No. And we are firm with that. In fact, our contract language is firm for the term. So we have not accepted any tariff-related increases through our portfolio. Now, that doesn't mean that every one of the categories that's available by that supplier is on contract. You may not be using a Premier contract. So that tool allows you to go in, look at it by supplier, look at it by category, look at it by geographic part of the world for country of origin, and project what your tariff increase might be. And that's also a tool that's available to all of our members that you can look at online. Now, I talked a little bit about AI. AI is an area we are investing in a big way. And our starting point for that AI investment is in supply chain. That company I mentioned that we're working with, we also did a use case with them on supply chain automated intelligence. And we gave them a scenario, we furnished them some blinded data, and we said, here's some purchasing data for a year. Here's reported by the supplier. Here's what we're getting from our members. We want to come up with a use case that will automate that data to make the procurement process faster and smarter. And in 12 hours, what they came back with was basically automated purchase orders, where it was looking at your historic purchasing. It was doing highlights which said, you know, the pharmacy generic price changed overnight. You're purchasing these generics from this wholesaler. This wholesaler has actually responded faster because it's linking to their data. Or you're purchasing this product. This product is actually a therapeutic equivalent or clinical equivalent is being available by a contracted supplier at a discounted price. It's doing all of that back-end analytics on a daily basis, and then you as a supply chain professional could say, yeah, I will accept that automated PO, or I'm going to go in and I'm going to make exceptions. And this is just scratching the surface of what some of this data will do. Now, to be clear, this is not picture a future state 3 years from now when this data can be used. This is stuff that literally is not weeks, but maybe a few months away. And we're doing some of the pilots with that right now. This is going to take investments. This is going to take investments that are frankly larger than probably any one of the individual members in this room can do. Frankly, larger than the investments probably any of our more healed organizations in Premier could do. And I think about some of our big, $15 billion net patient revenue organizations. We, Premier, are going to have to make some investments for the long haul. These are investments that are going to take maybe several months, maybe a couple quarters, maybe a year to pay off, but we want to do it in concert with our members. So that leads me directly to the announcement we had about a month ago, which is that Premier is going to soon not be publicly traded and be taken private by Patient Square Capital. And I want to talk about that a little bit because it's a really important step. So I mentioned I've been with Premier since 2000, so 25 years. I was with Premier when we accessed the public markets in 2013. I'll look everybody in the eye and tell you, I absolutely believed it was the right decision, and I still believe that was the right decision, and unlocked a huge amount of capital for us to go out and acquire some great companies doing amazing things that really rounded out that strategy. But those suppliers in the room will understand this. You know, when you're publicly traded and you announce that you've acquired a company like we did back in July, which is Illumicare, I mentioned that earlier, clinical decision support can improve your per discharge dollar return. The first question the market asks is, well, how soon will that be accretive to the stock? When will we see the revenue uptake on that? It's a little bit hard to do longer term investments when you're constantly driven by that quarterly cadence. 2 years ago, you may recall, we announced that we were going through what we called a strategic alternative process. At that time, we knew that the public markets probably wasn't the best fit for Premier. We talked to a bunch of private equity companies. They were interesting. We liked the fact that they were willing to invest, but healthcare was just a vertical within those companies. We actually looked at, could our members take us private? We had conversations with some of our large members about, would you be willing to invest and take us private? And of course, we started doing share buyback to start taking some of those shares off the street to make this transaction a little bit easier. Ultimately, we decided at that time that there wasn't the right partner for us, so we said, we'll stay public. And that's the path we had been working down. In the May timeframe, Patient Square Capital approached us, and they said, we're interested in Premier. We've been following your company for several years. We'd like to sit down and meet. We met with them in May. So I'll do like Tarantino. I'll jump around the story a little bit here. So we met with them in May. September, we announced the close. That's a pretty expeditious time frame if you've worked in this space. The first day we met with them, we were incredibly impressed. The senior partner of that company, Jim Montazzi, was the one that actually was the founder or one of the partners at KKR that took HCA public and took them private. So he knew about the space that we played in. The individuals that worked there asked really great questions about our business. If you look at their portfolio of companies, Premier is the only acute, purely acute focus, along with our continuum of care, that's part of their portfolio now. They're on the fringes of acute care. So for us, we're excited about getting access to their capital, getting access to their strategic investments. We also think this is an opportunity for private equity to flow into the acute care side of healthcare. I think all too often, if we wanted to look at private equity with a bit of a slanted eye, we would say, well, private equity is mostly focused on doing things that haven't helped the acute care. They've invested in physician groups. They've focused on high margin things like anesthesiology practices, things that have caused us fits on the acute care side of the world. This is an opportunity for us to sit down now with you, our members, talk about what are the things that are important to make sure our healthcare, rural healthcare, urban healthcare, community-based healthcare, not-for-profit healthcare, how do we make sure it remains viable for the long haul? So we're incredibly excited to partner with them. Why we think it's better to be at the public market as well is not just because of getting that pressure off of the quarterly cadence. It's also because if I heard any critique since 2013 of us going public, it would be from members from time to time where we'd announce something we did, and the members would say, well, gosh, if you had just told us that you were going to do that, we may have given you some feedback that could have influenced it. Well, when you're a publicly traded company, you can't share that kind of non-public information because that's an SEC violation. And if I wanted to, I'd have to sign you into very, very, very strict NDAs, which meant that you were pretty much locked out of any transaction with us or that supplier for some finite time period. So for us, what I'm excited about is being able to sit down once this deal closes, have very transparent conversations with all of you. You tell us in more demonstrative ways through our committees and through our field relationships and through your Yankee colleagues, what are the areas that we should be investing in, and then we'll go find those solutions for you. Last thing I'll say is this. They are trying to build this out together with us. So I could not be more excited about what the future holds for Premier. I couldn't be more excited about what that future holds for Yankee. But of course, all that is because it's an exciting future for all of our members, which encompasses all of you. So we think the future is very bright. I'd love to open it up for any questions you have, and I'll be happy to answer what I can. I'll end with this, though, on a timing perspective. So when we announced that we are getting acquired, we put Q1 26. Our fiscal year 26 starts July through August. Q1 26 was calendar year 26. We're working incredibly hard to get that closed. My belief is the longer it takes, the more noise that gets into the market. We actually think there's a chance it could close within the next several weeks, and that's the pace we're all working at. So I will answer as much as I can. I'll be able to answer a lot more once the deal closes. So let me open it up for any questions you folks have in the room. One brave soul. Steve, thank you for breaking the ice. Yes.
Andy, thank you. Really, really insightful to learn of the path forward with Premier. Partnership with Square Capital, any other big changes you see coming down the pike? I know that they've been a company that's heavily interested in and promoting AI and so forth. Do you see that as a strategic advantage moving forward? And have they mentioned anything to you about how that might impact your operating model? Give you advantage.
Yeah, great question. For those that didn't hear, the question is, as we look ahead with the partnership with Patient Square, what do we see changing from an operational perspective? They're very focused on AI. What does that mean for the future? Did I summarize it? So, it's interesting. Kevin DeBruni, who I think many of you know, we've got a VP that works for us. As long as he's worked for us, he's told these stories about a guy he used to work for. I'll tell you his version of the story very shortly. The story was he was working for somebody at Cardinal. They said, Zane, we're betting the future on you. We want you to move to Ohio, move out of rural North Carolina, move to Ohio. Zane picked up his family, moved there, and a week later the guy was gone, and Zane was stuck in Ohio working for somebody else. So I've always heard this story about that guy, and Zane held no malice towards the guy. In fact, he said, this guy's been a mentor to me for almost my entire career. The Monday we announced we were getting acquired, that mentor called up Zane and said, I can't believe that you guys are getting purchased by Patient Square. He's the CEO of Hanger, which is a company that's owned by Patient Square. And this was unsolicited. He said, you are going to love working with them. They are strategic. They've got capital. They want to put it to work. What they're not going to do is get into the details of your operations. If you guys are running the company well, if you've got the right vision, they're going to lean into that, and they're going to support you in that. The other piece, Steve, that I've seen with Patient Square is, again, they don't know the GPO space. They don't really know the acute provider space. They're on the fringes of it in continuum of care, but not really in the acute care side of it. And the analogy I've said to my team is, I don't think you spend $2.6 billion to monkey with the core of the business and the core of the strategy. So every interaction I've had with them has been positive. I do believe in that, what they said, which is we're going to build that strategy together. And believe me, I've tried to look for cracks in that. If you think about like police shows or when police round up suspects, what they normally do is, right, they put them in separate rooms, they ask them all the same questions, and they see whose story varied a little bit. We've met with tens of dozens of these folks. Every one of them to a T is absolutely on the same message. We want to work with you. We're building this out together. And when I say building this out together, that's code for we want to build this out with all of you. We need your input. There's that analogy, and I always mess it up a little bit. They always say Wayne Gretzky was the best hockey player because he skated to where the puck was going to be. I look at it and I say, what do I want from Premier and with our membership? I want you to tell us where to hit that puck, and then we'll skate towards it. And that's the input we need from all of you. So I see there will be some change in the future. I think for all of us in the room, we absolutely should be changing for the future. And if every one of your organizations is stagnant, I would say you might want to put your resume together. We are in an incredible time period right now where we have to evolve, and we're part of that ecosystem with you. So thank you for the question, Steve. Other questions? Starting to feel like I am between you and the cocktail hour right now. I can see that. Yeah, question here.
So earlier, Shomi talks about how cheaply tariffs are going to continue into the future. Appreciate that you guys have stood firm on not accepting any tariff increases at all right now mid-cycle. What do you see happening when those contract cycles renew, if tariffs are going to continue in the future?
Yeah, great question. So hopefully the folks are here. We've been holding firm on tariffs. When those contract cycles renew, what do we think is going to happen? So a couple things. And Amy, I'll ask her to kind of keep me honest on this. As the committees and Strategic Advisory Committee, one of them is we've been getting these requests coming in. We are facing some really tough challenges in this environment because, it feels good to say we're firm for the term. it feels good to say that we're not accepting any tariffs. But one of the lessons, and look, I'll be the first to admit, I didn't completely understand tariffs like most Americans when this thing started. One of the things I didn't realize was the pressure it puts on smaller companies, that they are immediately assessed those tariffs the minute their products get off the docks. Now, that's also why it's important for us to balance nearshore, onshore production. But what we don't want to do is put important small companies who are pushing the future out of business. So when I say firm for the term, I look you all in the eye and say that's where we're at. There may be a supplier or two where we do commit and allow them to do a mid-contract increase because we don't want to kill innovation and small suppliers. But we're going to be judicious how we do that. When we look to the next contracting cycle, it's going to be like we faced stuff over the pandemic, I anticipate. Whereas if somebody can show us that their raw material costs went up during the pandemic, if they can show us that there are legit reasons why the price is going up, we will maybe grant those like we did during the pandemic. But as soon as the circumstances change, we're going to expect that pricing to go down. We're going to expect to look at an indice like we did for the supply chain side of this and bring that price down. Tariffs, as we've seen, are being whipsawed right now. There's a tariff that goes in place today, and it might be gone tomorrow. It might be gone a month from now. When we get into that contracting cycle, we're going to have the ability to claw back on all that based on the market. Just because we agreed to a tariff doesn't mean it's there in perpetuity. But again, I want to be really clear. Our stance is to accept no tariff increases. Great question. Thank you. Yeah, question.
Your example about automating POs is interesting. We've been looking at purchasing data and how we do that. One of the challenges we face is drum shortage items or items that are not in stock. Can you
Yeah.
talk about how you might need to automate data and
Yeah, thank you. The question is, automated POs is interesting. You need more data to be able to actually do that in real time with multiple categories. So I think the invoicing data is going to be really important. That's another sounding data from us. We're already getting nightly wholesaler feeds in Premier. Excuse me one second. You know, one of the things I was showing our pharmacy program that we believe is unique is we have not outsourced our generic injectable program to the wholesalers or to the suppliers. We manage that program internally. And that's why we're able to, almost on a nightly basis, adjust that pricing. So we're getting near real-time wholesaler feeds. We also are working on more timely feeds from our distributor partners. All of those data sets are important. I used to have one of our supply chain leaders, she used to be the supply chain leader at Fairview, and Amy will remember this. She once said to us on our strategic advisory committee call, when I'm ordering a product, I'm being told by the distributor it's out of stock, and I don't know who to believe. I don't know if it really is out of stock or if they're saying it's out of stock because they want to offer a substitution that's at a higher price. So we have to triangulate all of these data sets to be able to accomplish that real-time PO. We think we're pretty close. So if we think about invoicing data, we think about the wholesaler data, we think about more real-time feeds from the distributor, fold that in with some of your patient data, you could see a future in which the AI can customize those orders based on what your CMI currently is or what your patient admittance looked like. Who are the surgeries that are coming up in the next week's schedule? And automate that and allow you to work on the exception, not the larger part of it. So more to come on that. But again, I'm telling you, I'm excited about this because this is not months, years away. This is maybe weeks and months. Thank you for that question. Other questions? Well, I'll end with this, and I think that this version of the Venn diagram really speaks to how we feel about this partnership. You as a customer, you as a supplier, we really do feel that the membership is better, that you're better, that we're better as a result of this partnership. So I do want to thank all of my Yankee colleagues. I want to thank Larry and the team. I want to thank some of the board members that are here. I also want to thank all of you. We know this is not an easy field that we've chosen. I'll say this. I'm not a religious person, although some people know the stories I've told over dinner. How my parents met was my father was a priest and my mom was a nun. That's how they met. So that's maybe explains why I'm not that much of a religious person. But I will say this. I do believe during the pandemic, every one of us had some divinity and every one of us was exactly where we needed to be. I think we are at an amazing time, and I think every one of you is where you need to be to help us be successful in what can feel like tremendous headwinds with HR 1. Necessity is the mother of invention. I cannot wait to see what we all come up with together. Thank you guys so much. Appreciate you.